Hello and good morning, everybody. Thank you so much for joining us today for our staff town hall, and happy Friday to you. I'm Hallie Nicholson, HR Strategic Communication and Engagement Manager, and I'll be your moderator for our town hall today. We've got a great group of panelists on hand to answer your questions, provide some updates on operations. We've got a focus on surveys today, which will be fun. Some of the questions that we're going to be answering today were submitted during registration, and we'll also be answering questions that are submitted in the chat function or the Q&A function. So feel free to submit written questions today using Q&A. This webinar has live closed captioning available in two ways. First, you can click on the closed caption button at the bottom of your screen and select show subtitles, or you can also click the link that was just pasted into the chat. So to get us started, I'd like to welcome our host for our town hall today, Pierre Huillet, Vice Chancellor and Chief Financial Officer. So Pierre, over to you.
Thank you very much, Haley. And for those who don't know, Haley is really the power who makes this town hall happen and brings us all together. And it's such a great way to have conversations as part of our community. So I'm very grateful for the role that you play, Haley. Today, we'll talk a little bit about COVID because it's still important. And thankfully, we'll also talk about other important topics for our staff, and in particular, we'll share the results of two of our most important channels for input and feedback about the staff experience. It's the Staff at Work survey and the Cooksar engagement survey, and our colleagues from the Staff Association will be there to share some of the results as well. These surveys are really important tools for our leadership to hear about the experience of our people on campus and to act on it. And believe me, we listen, we act, and we follow up to make sure that supervisors across the campus act on what they hear as well. Personally, one of my favorite parts is to look at the list of staff who receive recognition by name for their exceptional work and contributions to a great work environment. And we will be sharing their names later in the presentation today, and the recipients will also receive a certificate following today's staff town hall. So thank you very much to all of you who took time to share your feedback about UC San Diego and your ideas for making it better. Let's get started, and back to you, and thank you again, Haley.
All right, great. Thank you so much, Pierre, and thank you for the kind words. All right, so for our first update today, we're going to hear from Dr. Angela Socha, Interim Executive Director of Student Health and Wellbeing, for an update on all things pandemic, so vaccines, boosters, and all those topics. So we'll get our presentation started, and Angela, over to you.
Great. If you can get my video going and then bring up the slides, that'd be fantastic. All right, so basically, here's the national picture. We've been through another surge, and it is really an amazing, I think, to see how quickly this surge went up and then quickly came down. And we are seeing a really good picture in the United States because of that. Next slide. Oh, and how California looks. It looks very similar. An incredible spike, the January that was crazy, and a dramatic drop off to reaching levels that are almost where we were before the winter break. Next slide. When you look at indicators, I think it's important to realize the number of cases will come down more quickly than hospitalizations and deaths. Unfortunately, those who become very ill with this disease, that occurs later, and they will stay ill for a longer period of time. And then despite the best medical efforts, some of those individuals would die. And I share this because these indicators are still present and people are still dying, which, as we talk more about the importance of protecting ourselves through boosting as well as other behaviors, it's really important to keep in mind, while the levels are down, we are still having individuals become ill with this disease and die. Next slide. So how San Diego look? Kind of the same. Huge spike, very dramatic drop. Hospitalizations, which have markedly improved. For a while, they were over thousands every single day. They are coming down. The rate of positivity is coming down, and the indicators we follow in the county are turning green from what looked like in January, a pretty big red report card. Next slide. We go to our campus pattern and you see the yellow line. That's the quickest way to look at the percentage of tests that had positive results. And you see that in January, we were having over 10% of the people testing were positive. We had days with hundreds of students and almost 100 employees that were unfortunately coming down with this virus. These numbers have dramatically improved, and you'll see we're down to about a 2% or less rate of positivity of the individuals having tests. Next slide. This profile gives a little insight into campus employees and students being on the left in the blue. The dark blue are our students living on campus. The lighter blue are off campus. And you see the daily test number in January. At our peak, we were at 2,500 tests. Now we're running during the weekdays about a little over 1,000, 1,200 tests. On weekends, these numbers drop down. Similarly, employee tests tend to be about 500 a day. On the weekends, those drop down quite a bit. And then you look to the right in the middle bar, you see the on and off campus positives, which the number we've been running pretty consistently under 20 for the last week, which is great. Employee numbers are down to single digits. You'll see in January, there were days when we had 20 more a day. So definitely we're seeing a much better picture in the campus community of current viral infection. Next slide. Now, one of the great things about wastewater, it is a very early sign. We use it both on campus. We also use it to reflect what's going on in the San Diego community. And we look at the Point Loma, wastewater that is coming out of that treatment plant. The thing about testing is people have to go in for tests, but everybody is using their facilities at home and at work. So the wastewater coming out of large areas is really very reflective of what's going on with viral activity. It tends to give us a signal before we actually see the cases. Here, the signal in blue, and then the cases start to appear in the more orange color. Why do they lag afterwards? You're saying, well, if the cases are all better, why do we still see it in the wastewater? That's because people after infections continue to shed virus. So while the wastewater is an early indicator, it will lag in terms of the disappearance of the virus in terms of new infections because of that persistent shedding we've seen with this virus. And that is just one of the characteristics of this intermittent shedding of fragments of virus, enough virus to be picked up, but not enough to be infectious. So that's why the signal in the wastewater is a lagging indicator as well as an early indicator, but it's been very useful. Next slide. We also can do the sequencing of what's coming out of that wastewater, and that lets us know what kind of virus variant, what COVID variant is circulating in the community. And you'll see in Thanksgiving period, it was pretty much a Delta world. Almost everybody's infection was related to Delta, and slowly Omicron started to sneak in. It started to sneak in just about right after South Africa. It didn't take that long for a variant to hop across the globe. And I think this is an important reminder, is this is going to only be addressed through global efforts, because a variant which arrives in one part of the globe doesn't take very long before it will arrive in other parts of the globe. And you see the rapid takeover of what was being shed and infecting people in San Diego area became Omicron because of its high transmissibility. So that now pretty much what we're seeing is Omicron. Next slide. And we have the new variant, which is called BA.2. It is technically being referred to as an Omicron variant, BA.2 versus Omicron BA.1. And they say Omicron, they say Omicron, both are okay. It is actually not exactly the same, and we're going to explain why it's considerably different than the current variant BA.1 of Omicron that we're seeing. It is taking over quite substantially. You'll see that in India, this variant, BA.2, also called the stealth variant, has started to dominate. And then in other parts of the globe, South Africa, as well as you'll see up here in Finland, pretty high rates. Excuse me, that's Sweden and Denmark. But in the US, we've got a little bit more of the blue. Low levels in this country, in Canada. So it is moving its way, and we should expect it to start to have an impact. The question is how big an impact it will have. That remains to be seen. Next slide. What we have seen in this graph, and what you see is if Delta is the orange, and then the light green is the Omicron BA.1, And then the darker green is BA2. You'll see what happened in South Africa, where it kind of swaps out from Omicron 1 to the BA2, from BA1 to BA2. You see in India a dramatic change. Similarly, where it basically Delta went away, Omicron started, and they had a very quick pickup of the BA2 variant. So these variants do have a way of replacing the current strain. And the reason they do that is because of their high transmissibility, they infect larger numbers of individuals. That doesn't necessarily mean they're more dangerous in terms of severity of disease. They've actually been a little less in terms of severity of disease, but they infect very quickly and very easily are transmitted. So large numbers of infections can occur. Next slide. When you look at this, this just shows you how what the variants are doing. They are changing amino acids. So if we start out with the first variant, then alpha changed a little bit, beta, gamma, delta changed a few more amino acids. You see BA1 changed quite a bit with about 30 changes, 30, 35 to 40. And then BA2, again, more changes, but BA2 is a little different than BA1. We are very carefully watching BA2. Right now, there's been a little bit of activity in San Diego and a little bit in campus. We are not seeing yet an enormous spike related to BA2. We don't anticipate that's what's going to happen based on other areas and other things we're seeing. But I want folks to know that we are watching it very carefully. It is also some of the reason we're being conservative in some of our approaches. And you'll see as I go through some of campus policies and current recommendations that there is maybe a little more conservative approach, but for very good reason. Next slide. So we now have a mandate to be boosted and vaccinated. Full vaccination, it requires boosting. We know that immunity wanes. Now, it wanes in various ways, and our immunity is made up of both the cellular reaction as well as the antibody reaction. Some of that is much more protective of severe disease, and we've seen that our primary vaccination and boosters do help considerably, even with the variants, with severe disease. That the people that are becoming very ill are the unvaccinated community. So it's really important that we stay up to date with vaccination, which means when you're eligible for a booster, you get that booster. That is your best protection. Now, the first day you get that booster, it doesn't immediately kick in. It takes about a week, right? So individuals who are considered fully vaccinated, up to date, they got their booster a week ago, they're good to go for now, or they haven't yet become eligible for a booster, you're still fully vaccinated. Individuals who've never been vaccinated or recently got a booster just yesterday, or they're eligible and failed to get a booster or never completed their initial series are no longer up to date. They're now considered not fully vaccinated. The term we're going to be moving to more and more in our communication will be, instead of fully vaccinated and not fully vaccinated or unvaccinated, will be up to date with vaccination. So you're going to be hearing that more and more. Next slide. So when do you need to get a booster? Well, if you have the mandate, let's cover the mandate first. The mandate went into place and it does cover boosters, okay? And so enforcement will begin on March the 1st. So if you are eligible and you are a campus employer student, you have 30 days from the moment you became eligible to get that booster. If you've had a recent COVID infection, we're recommending that you delay that booster, and we've automatically extended your eligibility by 90 days in EPIC. So you don't have to worry if you've been one of those individuals who had, unfortunately, an infection in January. We've extended your eligibility by 90 days, but then we do want you to get boosted, okay? If you currently have an exemption to boosting, either a medical or religious exemption to vaccination, it covers boosting. You don't need to submit another one. So if you have a permanent medical exemption to vaccination or religious exemption, it also applies to boosters. So no need to submit that into an additional exemption request. We know about it. Next slide. So surveillance testing. What's really important is that those individuals who are no longer fully vaccinated, no longer up to date, whether it's because you have an exemption and you're unvaccinated, or you're no longer up to date with your vaccination, you need to test twice a week. An exception to that are the individuals who recently had that COVID-19 infection. And for 90 days, you should not do any surveillance testing because of that periodic shedding. The next type of testing is when you develop symptoms. If you have the new onset of symptoms, regardless of your vaccination status, we need you to test. So even if you're up to date, because we know some folks, even though they've been boosted, will acquire an infection, they should not, they're very, very unlikely to get severe disease unless they have underlying medical conditions in which even a mild infection could be dangerous for their health. And that does happen, which is why it's so important that we get this virus to the lowest level possible, because we will always have vulnerable people in our community that are medically have underlying conditions, whether it's cancer or a heart transplant, and even a minor infection can be devastating and actually result in loss of life. So getting this virus under control for everybody's benefit is so important. The one time that if you're within the 90 days and you have fully recovered, but suddenly you start to have new symptoms, we're asking you to speak with a healthcare provider. We may recommend in that setting that you do test again, and certainly wear a mask if you're having respiratory symptoms, because this will stop the spread of other viruses that cause, sniffles and colds and the flu, etc. So when you have respiratory symptoms, masking works for not just COVID, it works for other viruses as well. Next slide. Wastewater. So if you are working in a building or live in a building with a wastewater signal, please test, even if you are, again, fully vaccinated. So regardless of vaccination, test. If you've recently had COVID-19 in that setting, we're not recommending that you test. If you've been exposed to this virus, we do recommend that you test regardless of your vaccination status, again, unless you're in the 90-day window. But if you have been exposed, vaccinated or unvaccinated, we want you to test on notification, because this virus can actually result in infection in a couple days. And the new variant actually is even shorter, like 36 hours after an exposure, people are starting to show infection. And then test on day 5, because the good part, generally by day 5, the vast majority, not everyone, but the majority of people who are going to become infected will declare an infection. I'm going to talk about the other guidance for exposure, but specifically for testing, if you've been exposed and you've been notified, whether it's the Cal Notify app or you've been called by public health, a contact tracer, that you've been exposed, then you should test as soon as you know, make sure you aren't already infected, and on day 5. Next slide. Masking. Masking is very effective. All the studies show this. With the higher transmissible variants, the Omicron variants, it is important to have a more sealed mask, a tighter fit, because even a small amount of viral particles in the air can cause an infection. For this reason, we're moving everyone to KN95s or N95s. These are available at the Price Center and the Trove. Now, other option is to use a surgical mask with a cloth covering, so double layers. Where do you need to mask? We need to mask in campus in all of our indoor areas. This means the classroom, research, workspaces, unless you happen to be alone in an enclosed office and you don't anticipate anybody joining you. We're recommending no food or drink at indoor meetings for now. You can have meetings, but please be masked throughout those meetings. For our residential undergraduate students, they have moved to what we call phase 2. This allows them in their indoor unit, in their residence, just inside that indoor space, to drop their masking. It gives them a more normal experience. It's kind of like a household where we don't wear our masks all the time. Remember, in phase 1, they wear their mask everywhere except the bedroom and when they're in the shower. Because we've seen a drop down in viral activity, we moved to phase 2. So when they've entered their units, they can take their masks off. They don't, though, in the hallways, in the elevators, and lounges, etc. They are still masking. So please adhere to indoor masking. Next slide. Isolation requirements. These got changed a little bit. I reviewed them last town hall, but we'll go over them again just so everybody remembers that the period of isolation with an infection is 10 days. Now, we have a modification which allows you, if you no fever, you're not taking Tylenol, no fever, your symptoms are pretty much gone, and you have a negative rapid antigen test, you can leave the isolation room that you've been in for those 5 days. But you need to mask for other people, around other people for a full period of 10 days. Now, a number of people are still rapid antigen positive on day 6 or 7. If you're positive, complete the 10 days. We don't recommend that you test every single day until you're trying to find a negative day. Do one test, day 5 afterwards, or day 6. If it's negative, then you're pretty much are able to leave, but stay masked. And if it's positive, complete the full 10 days. Next slide. And the quarantine requirements. So this is for exposure. Isolation, you have a diagnosis, you have the infection. Quarantine, you've been exposed. For the individuals who are up to date with their vaccination, we just recommend that you test on notification day 5, but you do mask around others for 10 days. This is the safety precaution. Just in case you're one of those individuals who does convert and develop an infection, you want to avoid giving other individuals the infection, spreading the virus. So mask for 10 days, but you can move about, you can come to work, you're in very good. And we have specific requirements for our athletes so that they're able to train. And we have some special things. I'm not going to go into that detail, but if people are wanting, we are taking really some extra precautions for our athletes to keep them in good health, safety, and allowing them to compete. They're having some great seasons and doing very good self-care in that space. But for the rest of us, we can pretty much do most of our activities on campus, but we have to be masked. If you are not up to date with your vaccination, or you are unvaccinated and you've been exposed, you need to stay home for the 10-day period. You can do a day 5 test, and if it's negative, you can return. But to return to work, that test needs to be an observed test or provider distributed test. So if you're an employee, a student employee, and you've been exposed, you stay home for the first 5 days. If you're having no symptoms, you sign up through the RTL site for a test at one of our sites. Health system drive-ups work great for this. You sign up for a test, you get a test. If that test is negative, then you can come to work, but you still mask for 5 days. And again, that assumes you're not having any symptoms. So that is the summary I've got for today, and I'll be monitoring the Q&A, and I'll be available for questions and answers at that period as well. Thanks.
All right, thank you so much, Angela. Always a wealth of information to share with us. Next up, I'd like to introduce my HR colleague, Terry Winbush, our Senior Director of Labor Relations and Employee Relations, for some updates from HR. So Terry, over to you.
Thank you, Hallie. Hi, everyone. Good morning. Happy Friday. We made it. So as Angela was mentioning, related to the vaccine mandate, our new employees have 2 weeks from their start date to demonstrate that they are up to date on their vaccination. The booster requirement is built into that initial mandate. So we are saying that again to make sure that you all hear and understand that. The mandate enforcement, as Angela mentioned, will begin on March 1st. So some supervisors may be wondering why nothing has changed in their dashboard yet. And that's because we have not flipped the switch yet because the enforcement process has not begun and we didn't want to create any confusion. If you as an employee are not yet eligible to get boosted, then you must get boosted within 30 days from your eligibility in order to stay in compliance. And if you have had COVID within the last 90 days, you do get that automatic temporary medical exemption for 90 days post your PCR positive test. So I know some of you asked in the chat, is it 90 days post symptoms or post the date of your positive test? And it's post the date of your positive PCR test. This is why it's so important for you to make sure that you send in your positive PCR test information if you got tested outside of UC San Diego, so that we can get that temporary medical exemption documented. And thank you, Amy, for putting that in the chat. Please note that after a positive COVID test, all employees must obtain return to work clearance. This includes student employees. I know there's a little bit of confusion because student employees are students first. Yes, they are. But in their employment capacity, they have that option of, like Angela was mentioning, of doing the rapid antigen test at day 5, 6, if their symptoms are resolving, to return to their work. And so that's the employment side that they need to get a return to work clearance for. So please make sure that you are doing that. Supervisors, please make sure that you've seen the clearance before allowing someone back on site after they have been away from the office due to COVID. There is a new COVID leave. It's kind of hot off the presses. Maybe it's a little warm at this point. It's cooling down some, but as of February 19th, OP, the Office of the President, issued a new allotment of 80 hours of emergency paid sick leave for quarantine, testing, diagnosis, vaccination, childcare, and or a positive COVID test, or if you have some sickness from getting your vaccine or your booster. And those details are all available on the page that Amy put in the chat. Thank you. And this is available to all staff, including non-academic student employees, regardless of their start date. And so this is different than the 2021 emergency paid sick leave. And I know you're all saying, oh my God, Terry, all these leaves, how am I supposed to keep track? You don't have to. That's why we have Blink Pages, and that's why we have fabulous HR contacts in your departments and things to help you figure this out. But the change is that there's no start date limitation on whether or not you can access this leave. And there are additional categories that allow you to use this leave that the 2021 version did not allow. The 2021 version is still available for those who did not already use all 80 hours of that allotment. So, please avail yourself of this. If you have to be away from work and cannot work remotely due to one of the qualifying reasons, please use this to continue your pay status. Next slide, please. So as Angela mentioned, our indoor masking requirements remain. I know a lot of you saw that that California lifted some indoor masking restrictions for our vaccinated folks, but UC San Diego has not made that change yet and will continue to require all individuals, regardless of vaccination status, my dog wants to be involved in this conversation, to mask indoors at the university when in a meeting or your workspace. We're still being guided by national, state, local, and campus data and our fantastic medical experts that guide us in these decisions. Please also take this time to review and revisit flexible work arrangements for your staff. Many of you started these arrangements as early as last summer. And as you have been continuing, I know you are continuing to look at your operations and what your business needs are. Please revisit those. Remember to frequently check in on how they're operating for your operations. Could more flexibility be afforded to meet your operational needs? Should alternative work schedules be considered to meet off-hour needs that your customers might really benefit from? For example, do you serve areas that have customers that actually work night shifts and things of that nature? So you want to make sure that we're serving our entire population. How well is the flexible work arrangement working? And then if it's not working, make adjustments. That's the point of the flexibility. And then don't forget to update the work location status tool. So remember, we've talked about this a number of times, that the work location status is required information for all employees regarding their work location and their schedule. This information is critical for campus space and safety planning, parking and transportation programs, just to name a few of the ways that information is used. So sometimes even as it relates to the vaccine mandate, we look to see what is a person's work location status. Are they off-site? Are they on-site? How frequently are they on-site? What would their testing requirements be, et cetera? So please make sure that is updated. If you haven't looked at it today, I would suggest click on the link and make sure your information is updated today. Next slide. And then lastly, but not least at all, I often remind you all in this town hall and in other forums to continue to show grace to yourself and to each other. And someone asked a question not that long ago in one of our trainings, I'm not sure I know what grace is. How do you show it to others and to yourself? And I was like, that's such a great question. Grace is not some sort of unreachable, ethereal thing. Grace is really when you take that time to not call out somebody because it's not constructive, right? They use the wrong there of there, and there in an email, and you didn't call it out. You just showed them grace. You made a mistake in some information that you were sharing, and you forgave yourself because it really wasn't something that it was a big deal. It's simple things like that we can do for ourselves and for each other to care for our own mental health and well-being, and to just be better humans to each other. So that's what grace is. And that's something that we need to not only be practicing in this time of the pandemic, but it's something that we want to continue now and forever. And so I will continue to say it. I will beat you down with grace. So just be prepared for that. The other thing that I wanted to share, so sometimes these things comes to me in the night and I'm like, I want to share this with folks. And so bear with me. But for those of you all who are supervisors, managers, leaders of people, be the leader who asks what your employees need from you. Be the leader who leads by example and shows that it's okay to be yourself at work and be open and make mistakes. And then ask again. Be that leader who asks again what your employees need from you. And then try and provide it or work with them on ways to get their needs met, and resources that we have across the organization. So that's what I'll leave you with today. Thank you for letting me bend your ear for a while. And Hallie, I will turn it back over to you.
All right. Thank you so much, Terry. All right. So shifting gears a little bit, as I mentioned at the beginning, we're focusing on surveys this month. So I'd now like to introduce Cheryl Olson, Principal Administrative Analyst in Operation Strategic Initiatives, to share some results from the Staff at Work survey. So Cheryl, take it away.
Okay. Next slide, please. Good morning, everyone. And first, I want to start off by thanking all of the participants in the Staff at Work survey for this year and every year. Our survey was conducted between August and September this year, and 2021 was actually the 25th administration of the Staff at Work survey. So we've been collecting data for quite a long time. Participation was down a little bit over the past couple of years, which we're attributing to kind of the stresses of COVID. But even with those stresses, over half of staff are still participating in the survey, which gives us a great margin of error of less than 1%. So even with COVID and all of the changes that we've been going through, at least more than half of our staff are still participating. Next slide, please. 74% of the staff either agreed or strongly agreed that they were satisfied employees of UC San Diego. So we're still doing well in that area. Next slide, please. The overall mean for the items was 3.92 out of 5, which falls in our good range. There are 57 standard questions on the Staff at Work survey, and they're divided into questions about the university as a whole, about your department, about your supervisor, about how well you might be doing in terms of use of your skills and tools, and finally, diversity and climate. So out of the 57 questions, the overall mean was 3.92 this year. Next slide, please. The way we look at the items on the Staff at Work survey is in terms of a couple of different questions. First, we look at overall satisfaction, and then we look at the way items are correlated with that question. So influential strengths are items that are both rated really highly and are also strongly related to overall satisfaction. So in terms of the strengths this year, UC San Diego promotes a work environment where everyone is welcomed. Our department promotes a work environment where everyone is welcomed. So both the university as a whole and also your individual department. Does our department practice the principles of community? Does my job make good use of my skills and abilities? And do staff members at UC San Diego value my contributions? So these are the items for the university as a whole, where they're both given a relatively high ranking in the 1 to 5 scale, and also are strongly correlated with overall satisfaction. Next slide, please. Primary opportunities are the items that are rated relatively low, but are also strongly correlated with overall satisfaction. So there might be some items where they're given kind of a low rating, but they're not really considered all that important to people. But these are the ones where the rating is relatively low and they're also strongly correlated with satisfaction. And this year, I feel very valued as a member of the UC San Diego community. University leadership is genuinely interested in hearing our ideas and opinions. I'm satisfied with my opportunities for career advancement. I'm satisfied with my total compensation, and I have a voice on campus. Satisfaction with career advancement and satisfaction with compensation are kind of perennial things that come up as issues. But this year, feeling valued as a member of UC San Diego and having a voice on campus were also important opportunities. And we wanted to dig into that a little bit and see why these items are kind of coming up this year. And so we took a look at some of the other items. Please, next slide, please. Most items didn't show significant changes between 2020 and 2021, but there were 6 items that showed a significant drop, statistically significant drop. And those were overall satisfaction with UC San Diego, satisfaction with diversity-related programs and services. Department has adequate staffing to handle workload, feeling physically safe in the work environment, amount of stress associated with job, and satisfaction with total compensation. And I think this year there were particular stresses that went along with these items. And so we took a look at the open-ended comments that people provided. These are anonymous, but they do show certain themes. And we can see those themes if you take a look at the next slide. Breaking down the themes that we saw, salary and pay were an issue. These are the most significant themes that people expressed in their comments on the Staff at Work survey. Salary and pay, appropriate stress, feeling valued by department, and adequate staffing. And these particular themes are the ones that kind of come up in a standard way on the Staff at Work survey. But if you go to the next slide, one of the things that was coming up again and again in the themes that people were expressing was stresses related to having enough staff and also the financial information systems rollout. So we did hear from you about that. We did hear the concerns that people had about that, and also about retaining enough staff to be able to cover the workload that people were experiencing this year. So those were the themes that came up. We did hear you, and those are the things that you can be addressing with your departments and your department leadership. Next slide, please. The highest scoring items to end on I think a more positive note is that in general, staff feel very supported and respected by their supervisors, by their colleagues, and by the departments. So those are the highest rated items that we saw in the Staff at Work survey and that we continue to see year after year. Okay, last slide, please. Over 1,300 people were mentioned by name in the item where we asked you to tell us who you appreciate among your colleagues. These were the staff that were mentioned at least 5 times or more by colleagues. And so we do hear that you appreciate the people that you work with. Thank you.
All right, thank you so much, Cheryl, for that information. On this slide, it looks like, and we can put this link in the chat as well. Here's some information about, and folks can dive into these results just a little bit more.
Yeah, thank you.
Great, thank you. All right, so that was great to learn more about Staff at Work survey. I encourage folks to dive into those results just a little bit more. Moving into another survey that happens in our UC community, I'd like to welcome Jen Bowser, the chair of our UC San Diego Staff Association, to kind of introduce this next survey, which is our CUCSA survey. So Jen, handing it over to you.
Thank you so much, Hallie. And good morning, everyone. Congratulations on making it to the end of a short week. The Council of UC Staff Assembly is also referred to as CUCSA, is a UC-wide assembly of staff that is dedicated to improving communications between UC staff and administrators. The council's objective is to provide service to the university by advising and providing a staff perspective to decision makers. The council includes 2 delegates from each campus and also the Office of the President and Berkeley Lab. UC San Diego's delegates are myself as the Staff Association Chair and our Chair-elect Chuck Stanley. Through CUCSA, we communicate about matters affecting staff, such as benefits, change management, diversity, wellness, and engagement. With the support of the UC Office of the President, CUCSA began conducting a staff engagement survey in 2012, with follow-up surveys in 2015 and every other year after that. The objectives of the surveys were to better understand the current state of engagement of the UC workforce system, system-wide, and how it differs by key organizational segments and demographics. Also to determine what drives engagement at UC specifically. Additionally, to create a short list of actions to address issues and improve employee engagement across the system. And lastly, to involve and communicate with leaders and employees throughout the process. And so every 2 years, the survey invites a random sampling of policy covered staff to participate from across the UC system. It is the charge of the CUCSA delegates to review these results for their corresponding locations in order to identify areas of concern and create action items to address these opportunities. So I'd now like to welcome our UC San Diego Staff Association Assessment Chair, Shannon Milligan, to provide the overview of our campus's results. Shannon?
Well, thank you, Jen. I don't know about y'all, but I'd already forgotten this was a short week, so that was kind of a surprise reminder to me. So looking at the 2021 CUCSA survey, we had just over 3,000 survey invites sent out to UC San Diego campus employees with a 43% response rate, which was a 3% increase from the last survey that went out in 2019. Next slide, please. So I'll offer a quick primer for reading the graphics that you're seeing, which were provided by Willis Towers Watson. So the colors indicate whether favorability is higher or lower than a particular comparison group. So for example, if this was a survey that we had given to our students asking about the number of raccoons on campus, and they felt more favorable than last time, you would see green. And the darker the green means the greater the percent difference from that comparison group. So let's say that the students felt less favorable, then you would see red boxes. And again, the difference in color indicates magnitude once again. So with that in mind, this is covering the strengths that were identified based on the CUCSA survey results. So our strengths were belief in mission and communication of updates and changes on campus. Now I can see that there's a slight increase in favorability on belief in mission compared to the 2019 results, and a slight decrease compared to the UC system as a whole. Next slide, please. Thank you. So thinking to the presentation that you just saw from my OSI colleague, two of the opportunities that we have listed align with the primary opportunities that were identified through the Staff at Work survey. And these were career advancement and compensation. As you may recall, retention was a top concern expressed on the Staff at Work survey as well. And we'll be coming back to talk a little bit more about retention in a moment. Next slide, please. Thank you. So similarly, as we saw with the Staff at Work survey results, the survey questions themselves are grouped into categories in order to make interpretation a bit easier. So these categories include communication, diversity, inclusion, and retention, among others. Next slide. So part of the reason for introducing the categories is because that's how this table is set up, which is showing the difference between the 2019 CUCSA survey results and the 2021 results by category for 13 UC institutions. And this includes, for example, the Ag and Natural Resources and UCOP, if in case you were like 13, that doesn't seem right. So the system averages for the entire UC system are the far left category here. So remembering the example that I gave about the campus raccoons, you can see that most of the results were more favorable in 2021 than in 2019. And again, because of the green that we see here, and especially some of the darker, or more of the darker greens, pardon. And so as a result, when we look at the leftmost column for the system average, there are a number of statistically significant increases between 2019 and 2021. So the exception, as I hinted at earlier, and as corresponds to the Staff at Work survey results, is with retention. You can see that almost across the board, there was a uniform decrease in favorability across the UC institutions, which resulted in the one statistically significant decrease in the system average between the 2 years. Next slide, please. All right, thank you. So this is the final slide that we have. And this is focusing on the UC San Diego results. So compared to both our 2017 and 2019 results, the columns are in a little bit different order. So the first column is 2019, next is 2017. Then we have UC San Diego compared to this year's UC system average in the third column, and then of all university staff that participated in this survey on the right. And so it's been a long week, even though apparently it's been a short week. But if you remember back a few slides, I noticed that our strengths included belief in mission and communication of updates and changes. And we see that reflected in the communication, leadership, and organizational change categories. And likewise, our opportunities related to career objectives and retention. And we can see a drop in favorability on retention across the board, again, where we see the red and especially the darker reds for 3 of the 4 comparisons. So something to note is that aside from retention, our 2021 results were more favorable than the survey results from 2019. And so, something to celebrate there is that we have made progress on supporting staff, but clearly, especially seeing the results on retention and knowing that retention itself and why staff stay, why staff leave, is a contribution of all of the other categories and things that are beyond what we're presenting in both the Staff at Work survey results and also the CUCSA survey results. So there's definitely more progress to be made. I would definitely encourage you all to share your concerns and ideas with the Staff Association, as we have the ability to advocate on behalf of campus staff and really want to hear, ideas, especially for what would help with retention. What can we do to help keep our staff colleagues here at UC San Diego? And also attending these town halls is a great opportunity as well. So I'm going to give a plug, as I would not be a good Staff Association member if I did not do this, that we are having a pie and cold brew event on Pie Day, March 14th, on one of the best days of the year. And that would be a really good opportunity. We'd love to see you all come out if you're able to, if you're going to be on campus that day, and share your ideas, share your concerns with us over pie and coffee. Perhaps even saying that would be coffee and ideas on March 14th. And so with that bad joke, I will say be good to each other, and back to you, Hallie.
I'm still chuckling about coffee and ideas. So thank you for gifting us with that, Shannon. And thank you so much for all the work that you do for the Staff Association and for UC San Diego as a whole. That was really interesting data. All right, so now I'd like to invite, we'll move into our Q&A portion. And so I'd like to invite our Q&A panelists to come on camera with me, and we'll go through some of the questions that were submitted in advance of this event. So Angela, I know you've been typing fast and furious in the chat questions, so maybe we'll just kind of elevate some of those that we've seen. And one question that came in a couple different times was related to, let's see, let me find it. Oops, where'd it go? Oh, so I'll just read it out to you. If we got sick with Omicron after getting vaccinated and boosted, are we at less risk for possible future variants? So what does getting the virus do in terms of your immunity?
It does look like getting the Omicron BA1, which is what we had circulating, gives you some protection for BA2, and it's preliminary. It's always hard because we don't know what the next variant down the pipe will be. And as long as the nature of this virus is, it replicates a lot. It changes its amino acids. Some of those have no impact. Every once in a while, one of them has an impact that allows it to be more successful. So it's easier to transmit. It grows faster in the body of the person and in the next person. And then it becomes the new variant because it's adapted successfully. We're watching kind of all that Darwin theory that we learned in high school play out in action because of the very rapid cycling of this virus, which is why the more the virus gets to infect people, the more it gets to move around, it will develop more successful mutations. Because the ones that mutate and make it less successful, they drop away. So it's always hard to predict. But the preliminary stuff coming out on BA2 says if you had BA1 in this first run, you're going to get some protection from that. Now, everyone should realize we are getting protection from our vaccine, even though there are these breakthrough cases, because there are parts to our immune system that the vaccine doesn't give us the benefit of, but other parts we respond to the infection more effectively because we've been vaccinated and boosted. So even though the infection may start, it's going to be a milder infection. It's going to get over quicker. It's not going to put people in the hospital. It's not going to take lives. I say that also with realizing that there are frail individuals who have complex medical conditions. I mentioned a heart transplant patient. They get through life with a lot of care and they don't have the margin for illness that someone who's 25 years old and perfectly healthy and athlete does, right? And so we all have to know our personal health background and what vulnerabilities we have. And then knowing that boosting and vaccines will very much protect us against more severe disease. It also means that there'll be less shedding of the virus around, the exposures are less frequent, and then it drops away. So it's not a failure of the vaccine. I think there's been this perception, well, if I did that, what? I still have, yeah, unfortunately, but you got a lot less sick than if you hadn't had that booster, if you hadn't had that vaccine. And that's the really important part about this. So I don't want people to be discouraged because we did have breakthrough cases, no question about it, with this Omicron variant. Okay.
All right,
That
thank you,
helps.
Angela. All right, so Terry, I'm going to send this over to you. In advance of the event, we received a few questions relating to compensation, so things like merit increases, star awards, cost of living. So what can you share about kind of how those decisions are made, where those decisions are made? Because it's sort of a complex landscape.
Yeah, so I think especially for new employees to our complex UC system, it's helpful to know, and even for those of us who've been around for a bit, sometimes it's a nice reminder. So there are some decisions that are made system-wide. The Office of the President will make decisions about whether there will be a salary program each year, how the salary program is managed, whether it's a merit-based program, you know, your performance appraisal rating determines how much you get, versus whether it's a general salary increase, assuming you were satisfactory or above. And that's for our policy covered employees. Then there are the salary adjustments that are associated with folks who are represented. And those are negotiated for system-wide contracts at the system-wide level with local participation on those system-wide teams for those contracts for those represented employees. And so those are built into those contracts for the duration of the contract. So those are sort of the broader things. But then there are things like equity increases, retention adjustments, things of that nature. And some of those things are determined as far as like the caps at the campus level. And some of those things are determined at the department level based on what their needs are within their organization. So it really depends. When you think about things like Star Awards, for example, so system-wide approves the program that UC San Diego and other campuses present for the Star Award program, but it's only available for policy covered employees and employees who fall under the Teamsters clerical unit, right? So, and that's a system-wide determination. So there are parts that are system-wide, parts that are campus, and parts that are local. And it's always kind of a fun conversation when we're helping folks around compensation matters to understand sort of what parameters we're constrained by the system, and then other things that have to be considered as well. But we're trying to have a broader lens around compensation, especially given the nature of the change in the market and everything like that right now.
All right, that was a good synopsis. Good work cramming that into 90 seconds. All right, thank you, Terry. Angela, a question about boosters, and we saw this one come in a couple of times. So this person asks, will another booster be available in March or April, since many of us will be at the 6-month booster mark? So what are we hearing about potential additional boosters?
So lots of conversation on this and dialogue, and it is changing landscape. Right now, immunocompromised individuals should speak with their providers. They may be a group that there will be a release of boosters for them. We think that with time, there is a possibility other higher risk groups, such as those over 65, will have access to boosters. There's a dialogue about, do we hold off until the fall and link boosters to flu shots? Do we make them more available? This could change. So whether it will be broad scale, remember we first had vaccines, it was tiers and groups and steady. It may be something similar when we bring out the 4th boosters. Same way, when will the kids become eligible? Still to be determined, because they're trying to figure out when the children who got their primary vaccinations, immunity starts to wane. They have different immune systems, they may last a little longer. Younger individuals, we may get more benefits. So the 6-month, 5-month rule is not the same for everybody. So this is something that we're going to all have to keep an eye on. We'll be messaging through MyChart. That's one of the nice things. And we're able to indicate when people become eligible, and we'll communicate through the town halls. I can't give you a schedule yet because there's going to be a certain degree of national consensus that has to be reached for us to then start releasing it. What I will share is that I think we have a commitment to, if it becomes recommended, we will bring it in as it's recommended to make it available to our employees and students who qualify by the categories and the situation they're in, just like we did through the first phase, just like we did with the first booster phase. So all of that, we're watching it. Next town hall could have more information.
That is a perfect way to end today, for folks to just kind of keep an eye on information, read your emails, attend these events, look at your MyChart messages, and that's where you're going to get that valuable information about these boosters as they come down the pike. So with that, we've reached our time. So I hope everyone has an awesome and restful weekend. We're in the works for planning our next month's events. That's looking to be the end of March. So just keep an eye out for those details. And with that, enjoy your day and enjoy your weekend. And thanks so much to all our panelists. Bye, everyone.